Medgate Today Podcast, where business meets innovation in the world of healthcare. From medtech to pharmaceuticals, diagnostics and medical devices, we bring you the latest insights from the leaders driving the industry's evolution. This is Hera Ahmed, your host. Today we are thrilled to have a visionary in the healthcare sector whose out-of-the-box thinking is shaping the future. Please join me in welcoming Dr. Dodul Mondal, Director Radiation Oncology at Max Super Speciality Hospital, Saket, New Delhi. Mr. Mondal has 25 plus years experience in healthcare sector. Hello and welcome to the show, sir.
Hello everyone. Hi Hera, thank you so much and thank you Medgate for inviting me.
Dr. Mondal, what inspired you to specialize in radiation oncology?
It's a very interesting question. So, in our medical journey or in our medical career, there are different steps. So, first of all, we do our MBBS, and that's like a very generalized teaching and training about all specialties related to medicine and healthcare. After completing MBBS, we need to choose a little bit more specialized sectors. So, everything comes with some kind of entrance exam and we all have to prepare for that. So when I was preparing and I found that this subject is something which has very deep connection with physics, and being a very avid fan of physics, I like this subject very much. The second thing was, it was very interesting to see that a cancer can be cured without going through knife. That was very fascinating to me, that there is a treatment which can cure cancer and the patient does not need to go through the knife. So it's a painless treatment. There is no intervention by a surgeon. It's a bloodless treatment, and many cancers can be cured completely with this simple treatment, which is radiation. So combining both these things, my passion for physics, then the very innovative way of treatment, and when I was preparing for all these things, that was the time when radiation oncology was going through a major revamp. A lot of new investigations, a lot of new innovations were happening in terms of technology, in terms of machine. So there was a dramatic change in the way of radiation treatment compared to previous decade or previous century. So all these things actually inspired me to take this subject as specialty.
So sir, when we hear about the term cancer, people usually get very frightened and they feel that it is something which can't be cured. So as an oncologist, what are your thoughts or views on this?
Yes, so I know that this is a very common myth that cancer cannot be cured. There are so many things where I see that people mention cancer has no answer, which is absolutely wrong. We need to come out of this perception that cancer has no answer. Nowadays, sitting in 2025, most cancer definitely have an answer, and majorly many cancers can be cured for the life. If you look at the statistics, then it depends on the stage of presentation, at which stage patient is coming to us. Most of the stage 1 cancers, if we look at the data, the success rate or the cure rate is close to 85 to 90%. For all stage 2 cancers across the world, if the patient is treated properly, then the cure rate becomes something around 70%. Now, there is a dramatic change the moment the cancer presents at stage 3 and stage 4. Most of the stage 3 cancers, we see that the cure rate is something around 40 to 60%, and stage 4 cancer somewhere revolves around 15%, 20%, 25%, and in some cancers it can be as bad as 5%. So it all depends on stage of the cancer and also at which center the patient was treated, whether that center has all the advanced technologies, trained personnel, manpower, whether the treating physicians had the adequate reserve training or not. So there are a lot of things which actually increase the chance of cure. So it's very difficult to answer in one word, but yes, the word or the sentence is cancer has answer. And once upon a time, I want to give one more example, like the cancers in children, where blood cancer is very common. So there was a time when most of the blood cancers could not be cured. But if we look today, most of the blood cancers are now curable. So almost 85 to 90% of childhood cancers are nowadays curable. And we know that a lot of emotions are attached when a child gets a cancer. So yes, cancer has answer, and cancer is not curable is a myth. It's a wrong perception. So please reach a proper healthcare facility having proper setup, properly trained manpower, so that you can get the maximum chance to be cured.
So, sir, for our listeners who are unfamiliar with it, what exactly is radiation oncology and how does it offers it's better than other form of treatments of cancer?
Okay, so I will start this answer from the second part. So we never say that this is superior to something else or radiation alone is the magic. It's not like that. It's like whatever is the best possible treatment for the best interest of the patient. There are many cancers where radiation alone can provide cure. There are many cancers where radiation must be combined with other forms of treatment like surgery, like chemotherapy. Now we decide the sequence depending on the type of cancer, the stage of cancer, available facilities in the treatment center. So all these things taken together are actually the guiding factor for treatment decision. There are some cancers where radiation is given before surgery. There are some cancers where radiation is given after surgery. There are some cancers where radiation and chemotherapy combine together and no other treatment is required. So we cannot say that treatment A, B or C is superior to the other part. It's like you can say there are 3 or 4 pillars of cancer, radiation is one of them, and the entire cancer treatment is based on those 3-4 pillars like radiation, surgery, chemotherapy, and nowadays immunotherapy and targeted therapy. Now, coming to the first question, how radiation oncology is different or what exactly radiation is. So radiation is basically very high energy rays, that is what we commonly say. So there are different types of radiation. The most commonly what we use nowadays are basically photon. If you look at the developed part of the world, most of the centers are nowadays using linear accelerator. So linear accelerator is basically a kind of machine which uses very high energy X-ray. Now it is the same X-ray which we regularly use for doing our chest X-ray or abdominal X-ray or any other X-ray of our body for diagnostic purpose. Now the same X-ray with very high energy and intensity, along with different ways of modulating that, giving it a shape to take the shape of the tumor, and different machines which will enable us to precisely deliver this radiation within the tumor cells or the tumor, and which will also have the capacity to spare the surrounding normal healthy cells. So that is what radiation in a nutshell. And in radiation oncology, the main target is always to deliver as much as dose possible to the tumor and as minimum dose as possible to the surrounding healthy cells. That means hitting the target or the tumor very hard with the radiation, whereas keeping the surrounding healthy cells saved from the bad effects of radiation. Now there are other forms of radiation also, like particle beam therapy. Many of you might have heard about proton. So proton beam therapy is one new type of radiation where the radiation nature is like a particle. So it's hit the target and then stops. So radiation coming from proton machine is a bit different than radiation coming from the X-ray or linear accelerator. There are other particle therapies also like carbon ion therapy, but as of now we do not have carbon ion therapy facility in this country. However, we have almost all possible latest technologies related to linear accelerator and proton therapy in this country.
So, sir, coming towards the types of cancer, what types of cancers are mostly commonly treated with radiation therapy?
So it can be any cancer. Radiation can be used for almost every cancer depending on their stage, their prognosis, and time of presentation and the need.
Size of the cancer or the size of the tumor or something which we say that it's the cause of the cancer also plays a role in the treatment.
So yes, size of the tumor or the cancer definitely plays a role. How, if we know about the stage, then many cancers are actually decided by the size of the tumor. Say for example, we are treating a tumor in the oral cavity. We say that a 2 centimeter size tumor is stage 1, 4 centimeter then becomes stage 2, like that. Different cancers have different size criteria. So changing the size, or if the tumor becomes bigger in size, will increase the stage. That means the chance of cure will also keep on changing with the changing tumor size. Very small tumor will be early stage, easy to cure. The effect of the treatment will also be very less. Bigger tumor will require larger area of treatment, be it surgery, be it radiation. Many of these tumors, when they are in advanced stage, will also require chemotherapy. If the tumor becomes incurable because of very large size, making it unsuitable for surgery or unsuitable for radiation, then most of the time we can say that this is not a curable situation and the patient requires palliation. So in short, we divide the indication as curative and palliative. Curative means where we expect that the tumor can be completely cured. Palliative means a situation where we do not expect a cure, but then we treat to provide symptomatic relief from the different effects of cancer. So that is what we call as palliative treatment. And radiation can be utilized for palliation, like for giving relief to pain, sometimes to stop bleeding, sometimes to relieve breathing difficulty, sometimes to reduce pressure inside chest, like in lung cancer. Many times the patient comes to us with blockage of large blood vessels inside chest. We call them superior vena cava obstruction. So radiation is one of the known treatment which relieves this symptom. There are many other such symptoms where radiation provides good palliation. Spinal cord compression, where the tumor is going inside the spinal cord, pressing over the spinal cord and causing weakness of the legs or the hand. Again, radiation is a very good treatment in that scenario. So it reduces the pressure within spinal cord, and many times the patient can gain back the power. Okay, so those are like mostly situations where we talk about palliation. Radiation is mostly used for cure, and say for example in brain tumor. So most of the malignant brain tumors, they require radiation as part of the entire treatment protocol. So the surgeon first removes the tumor, and the radiation oncologist then gives radiation in a focused manner to the tumor part. There are a lot of cancers in oral cavity, in our mouth, in our throat, where radiation is combined after surgery, or radiation is combined with chemotherapy, or for very early stage tumors like voice box tumor, radiation alone can provide cure. Then if we think about lung cancer or breast cancer, radiation is mostly an integral part of the entire treatment protocol to provide cure. If we come down to abdomen, then many abdominal cancers like rectal cancer, in female we talk about cervical cancer or uterine cancer, in liver cancer, in pancreas cancer, there is always a role of radiation, be it as part of before surgery or after surgery, or without any surgery as curative modality. Okay, so radiation is, that's why I said to begin with that it's one of the 3 vital pillars of cancer treatment.